So we're going to ask everyone who can to please take your seats so we can get started. Welcome to the Book Festival. Thank you for coming and supporting these wonderful authors. And please show your appreciation for what they've done the very best way. Sorry, guys. I pushed it off with my phone. The best way to support this festival and the authors that participate in it is to buy their books from Bunch of Grapes, not Amazon, not whatever online store you can go to. Buy it here and then go to the author signing tent so you can have a final meet with the author and take home your treasure. Book signings follow every session here. They last for about half an hour. Please don't go hungry. There's food all around here. Make sure you're drinking plenty of water. Before we start today, please, everyone turn off your alarms on your cell phones. We all make that mistake. I do it all the time. But if you can, it just makes it a little less disruptive. We will have a question and answer session in the last 15 minutes. So please, as you're listening, think of the questions that you'll want to ask and then come up here on my right where the microphone is and speak into the microphone like I wasn't doing. All right, so let me introduce today. We have, oh my goodness, I just lost this. We are very lucky to have Rebecca Grant. She's a Portland-based journalist covering reproductive rights, health, and justice. Her work has been featured in The Atlantic, NPR, and The Washington Post. A Cornell graduate and former Peace Corps volunteer, Grant is the author of Access, Inside the Abortion Underground and the 60-Year Battle for Reproductive Freedom. The book is a journey into the underground activist networks that have been working to protect women's autonomy over their bodies amidst legal, political, religious, and cultural oppression. I especially appreciate this as a retired obstetrician gynecologist. Elizabeth Barnes is the president of the Women's Centers, a network of independent abortion clinics. She is the founder of Abortion Access for All, a nonprofit organization dedicated to supporting abortion availability. In 2023, she received the Champion of Choice Award from the National Institute of Reproductive Health for her decades of work expanding access to abortion to all women. She is a longtime Vineyard resident. Please join me in welcoming them to the book festival today.
Welcome, everyone. You came to the best book tent today. This is a fantastic book. I have read a lot of books about reproductive rights and access, and this is incredibly compelling, really fun to read for such a challenging topic. In the beginning, Rebecca talks about this being like abortion in the world of spycraft and sequins and underground movements and meetings in clandestine places, and it does actually have that to it. So I'm actually going to be buying this as gifts for people, which I wouldn't normally do because sometimes from the people in my work world, it just feels like work. Oh, you can't. I forgot to put the microphone.
I'm sorry. All right. Anyway, it's a great book, right? So, Rebecca, you cover a lot of ground. You really do. So, I'm wondering, when you decided to try and tell it with a narrative of the compelling and more exciting components, as well as real, accurate descriptions of complex history, how did you arrange it? How did you get into it and pick the three categories you divided the book into?
There's a way in which I sort of worked backwards. And so the scope of the book is 1965 to 2025. And in the lead up to Dobbs, I was doing a lot of reporting on activists who were preparing for what many of them anticipated would be the overturning of Roe. I've been on the abortion beat since 2015, and so I was pretty well positioned to find the people who were like, yeah, we're figuring out how to, illegally import abortion pills into the country. And so I was reporting actively as they were scaling up. Many of them were kind of inspired, I guess you could say, by COVID, because brick and mortar clinic access was really was really strained by the pandemic, of course. And so as I was reporting on these people, I found that they were really inspired and helped, actively, materially supported by international activists. So Veronica Cruz, who's a Mexican activist, and Dr. Rebecca Gompertz, who's a Dutch activist. And Dr. Gompertz and Vero had been working, at that point for over 20 years on enabling abortion access in abroad, but in criminalized contexts. And so for us, here in the US, for most people, we have been reliant on the clinic-based system for so long that these underground pathways, we really hadn't needed them in the same way. And so these international activists who have been doing this for decades, they knew what we needed to do. They knew how to evaluate people in the right way. They knew how to sneak the medication in. They knew kind of the appropriate protocols. And so then, that was really what took me in this international direction of okay, well, the Americans in 2022 are doing this, but they're learning from these activists who are abroad and what was their origin story. And then, partly by the inspiration of my editor, she was like, but what did the underground in the US look like before Roe? And are there these common themes? Are there these resonances? Even though the technology is so different, even though today we have pills, we have the internet, we have encrypted messaging apps, are there things that are in common between, 2022 and 1962 or whatever the spread is? And I had already done some of that historical research or reporting for other stories over the course of my career. And even I was kind of shocked by how many really strong connections there were. Philosophically, kind of ideologically, but even in terms of the strategy, even though the technology was so different. And so it created this sort of beautiful arc, this kind of narrative through line that I found really compelling. And so, kind of like I started saying, I was really starting with my contemporary reporting, with the stories I was actively doing around Dobbs, but then the further back I went, the more the further abroad I went, the more I saw all of these generations and continents and movements all being really connected.
Can you talk about a couple of the people that you interacted with that particularly moved you or you thought are worth extra sharing about? And then
Right, so two of the activists that I just mentioned, one is Dr. Rebecca Gompertz, and I mentioned her yesterday briefly in the panel, but for those of you who don't know, she is a Dutch doctor. She's not an OBGYN, but she was very passionate about abortion access, and she actually started her medical career aboard a Greenpeace ship. She was a physician on the Rainbow Warrior 2, and so Greenpeace sailed these boats to do campaigns protesting environmental degradation. And Dr. Gompertz learned more about international maritime law and some of its loopholes. And she had this thought, which was that if we could sort of do a boat campaign to promote environmental values, why couldn't we do a boat campaign for abortion access? And so her kind of radical, brilliant idea was that you would sail a boat to countries with abortion bans, take women into international waters, and provide abortions at sea, where the national law didn't apply. It was international law that applied, and her boat was flagged to the Netherlands. And she actually came through the US in 1999 to do a fundraising tour. And the people that she met with, leaders of the reproductive rights movement and the abortion fund movement here, they thought she was totally nuts, but they were also really excited and inspired. And so I don't think they actually helped her raise any money because US donors were a little bit more conservative than that, or a little more cautious, but she ended up getting the money that she needed and doing this organization called Women on Waves, which attracted international headlines. The stories were all over the world. So the first campaign she did was to Ireland, and it got so much coverage, and then Poland. And part of the campaign was certainly how do I provide direct access to abortion, but it was also, there was a performance art element to it. She actually had an art background, and a lot of what she was trying to do was draw attention, which certainly the idea of the abortion ship did. And so she did that for a couple years. The campaigns, certainly by an attention metric, were wildly successful, but ultimately she could only provided abortion care to a couple dozen patients, I think. And so that was what inspired her in 2006 to launch Women on Web, which was the first online telemedicine abortion service, which would mail people regimens of medication abortion all over the world. And so, today they've helped well over 100,000 people, if not more than that. And so she really was sort of always a pioneer. And she was always looking for these gray areas that she could exploit. So it was important to her that the work was fully legal, but she maneuvered in these really genius ways to make sure that everything was legal. So like in the case of Women on Web, it had 4 different components to it, and each of them was in a different country where that component was legal. And so the website was hosted, or the organization was founded, kind of incorporated in Canada, but she as a doctor was writing prescriptions out of Austria, the medication was coming from India. And so she, there was no part of it that any one government could stop. And they tried. I mean, Ireland tried, but she always prevailed because of how creative and determined she was. And then kind of the other big character, I would say, is Vero Cruz. And Vero was the founder of the accompaniment model in Mexico, which is a peer-to-peer network approach to sharing medication abortion. And so Vero was very active in a 2000 campaign in her home state of Guanajuato, where the governor was proposing to eliminate the rape exception to their abortion ban. And there was a lot of street protest and activity, and they prevailed. The rape exception remained. But Vero thought, there's sort of no point in fighting for this right if people who have been victims of rape are also not able to access abortion. And so she found a local OBGYN who was willing to provide care to patients who came Vero's way. And when that OB heard about abortion pills, about medication abortion, Vero observed her practicing, and she was like, I could do that. Like, this isn't that complicated. It's doing some evaluation questions and then telling people the appropriate protocol and making sure that they're okay along the way. And so that accompaniment model has spread all over Mexico, all over Latin America. And then after SB 8, which was the aid and abet law passed in Texas in 2021, Vero publicly went on TV. She went on Univision, and she was like, if anyone in America wants abortion pills, like, I got you. And so Las Libres was a really active part of how people in the U.S. kind of responded to Dobbs, and she was really public about saying to Americans, if any of you want to secretly distribute abortion pills, I'll give you them for free. Just come to Mexico and pick them up. And so in part 3 of the book, I profile a number of the American expats in Mexico who kind of are fondly referred to as the old hippies, who many of whom had retired to Mexico, and they were like, yeah, sure, I'll do that. And so I think in the case of both Vero and Dr. Gompertz, they had their own journeys, but they were also incredibly exciting and inspiring to Americans who were really heartbroken and panicked by the overturn of Roe and wanted to get involved in a very specific, practical way.
You end the book talking about one of those activists, Barbara, I think it is. Why'd you pick her? She's one of the older women who is an expat, and she's just this is a person in the book who in her retirement has been helping mail illegal abortion medications. And
I have a lot of pseudonyms in the book, so I'm like, who's Barbara again? That was one of the things that was really surprising to me as I was reporting. So I went down to Mexico a couple times to report on Vero and Las Libres and her network, and they introduced me to many of the old hippies, the expats that they had recruited. And certainly in the scope of the ecosystem, I met so many different people from so many different backgrounds who were involved in this work, but there was a lot of women who were retired and their children were grown, they were out of the house, they had their careers behind them. They were furious at the overturning of Roe in a way that I think was perhaps particularly tied to their memory of living before Roe and have been fighting so hard and achieved that milestone decision. And then to have that taken back, I think the reversal was maybe particularly poignant for them. And just that anger of my daughter or my granddaughters have fewer rights than I did. And so a lot of them were willing to take risks that were pretty bold. And so, Barbara, she was a retired woman. She wasn't super, super mobile. And so she wanted to know what she could do. And what she could do was pack pills up. So she would get kind of bulk orders from the sort of kingpin, I guess you could say, who would send her, just a lot of medication from India. And then Barbara and her husband would turn on the TV and she would put on her gloves and she would package the medication into individual little plastic baggies and put those baggies in envelopes. And then when she went to her physical therapy appointment, she'd drop some off at one post office and she'd have lunch with her daughter and she'd go to a different post office. And so she really incorporated this life as an underground abortion pill smuggler, just into her retirement routine as a woman in her 80s. And I think, there was another woman who's a part of the book named Katie, who she is kind of like the mule or the carrier, as she refers to herself. And she does a lot of international travel, and she's having the best time. Like, she gets nervous, but she's always messaging me, like, I'm going to this place to pick up pills, or now I'm going here. And I don't think she had traveled a huge amount in her youth. And so now she's having such a good time doing it for this sort of, nefarious but amazing purpose. And I had asked her once, like, if you get tired, would you just travel anyway? Like, could you just go to, I don't know, Italy for fun? And she's like, no, that doesn't really appeal to me. Like, I only like to travel if I can smuggle 10,000 pills back in my suitcase. So I loved meeting all of these people with their idiosyncrasies and finding out what motivated them to take such risks. And, were you an activist in your youth, or have you always been a risk taker? And I think for some of them that was true. And for some of them, they were like, no, like, I've never done anything like this. And their husbands were sort of like, I don't know what's come over her. But yeah, they're doing it with a sense of humor and panache. And it was really fun to follow them along as they were figuring it out.
It's really inspiring. When you were meeting these people and deciding where to travel, did you come up against barriers that we will often find when anyone is talking about abortion, the stigma and the culture around people being willing to talk in public spaces? Or did you ever feel in danger when you were doing your travels and talking to people?
I really didn't. I don't know if it's just because I've been on this beat for so long that I just sort of don't notice it in the same way. I also think that, it's not that journalists don't face risks, but I think the risks that I'm taking compared to someone who, is sneaking all this medication back or whatever the case is, like, it just feels so different to me. But there's a funny little anecdote in the book about this woman who I referred to as Jenny, and she's in her 80s. She lives in the US, and when Vero had said, if anyone wants pills, you can have them for free. All you have to do is come to Mexico and bring them back to the US with you. And Jenny really wasn't sure if she felt comfortable with that. So she was kind of like, I'll take the meeting. Like, I'm going to Mexico anyway for fun. So she met with Vero in a Starbucks, and Vero and Jenny both told me their versions of the story, but in Vero's version, Jenny shows up with like these big black sunglasses, and she has this black backpack, and she's kind of like, woman on the run in a spy thriller, and she was really not sure if she was going to do it. She had been really on the fence, and there they are in a Starbucks, and Vero's just like, do, like, pastillas, the pills, just talking full volume, unabashedly, and her brazenness, I think, really inspired Jenny. And so after the meeting, of course, Jenny was like, all right, like, I'll, fill up the backpack. And then back at her hotel, she, did all the things she needed to do to feel incognito, and put it in her toiletry bag. And for especially as an older woman traveling back to the U.S., like, it wasn't weird that she had medication with her. It's really normal for Americans to go to Mexico and access pharmaceuticals and prescriptions for cheaper than they can do it here. And so she did it the one time, and it was, I think, pretty nerve-wracking. But then once you do it once and, like, no one cares, then I think it feels a little bit safer to do it again. And then her friends started doing it, and they all are just kind of like, yeah, this is what we do now,
Cruise to Mexico and pick up some abortion pills and cruise on back. Do you talk about when you were first interested in reproductive rights and access as a topic that editors and papers were generally not interested in that as a beat and getting anyone engaged? And then you also credit the Fund for Investigative Journalism much later in your career for helping you get to travel to do some research. And I'm wondering if you could talk a little bit about the landscape of reporting and what you see as it stands now and the challenges on these. Because from where we're standing, there's just so much we still don't see out in the news that when I would tell any person in my life, they're shocked that they haven't heard about it. So
I started on the beat in 2015, and so I had just become a full-time freelancer, and I felt like I can write about whatever I want, and this is what I wanted to write about. And I certainly encountered editors or other journalists or people in media who were pretty skeptical that you could make a whole beat out of abortion access or out of reproductive rights. And I felt like that wasn't true. I thought that there were plenty of stories there, but I think the general consensus in the media was sort of like, this is settled. It's not that there's not some little stuff happening, but this, we've had Roe's been there forever. It's never going anywhere. And like nothing is really at risk here. And, just that sort of status quo mindset. And so I started reporting anyway, and I still found the stories. And then in 2016, there was the Supreme Court decision in Whole Women's Health versus Hellerstedt, which really upheld abortion rights. And that felt like such a victory, and it was. And then just a couple months later was the 2016 election. And then all of a sudden, everyone's freaking out about abortion rights and reproductive rights. And so there was sort of this whiplash, and it was really hard to know like how serious to take everything, because there was this win and then this wasn't. And so, I mean, in some ways, it was a really good time to be someone who was already on the beat, because I was, I think, for some editors, a natural person to go to continue reporting on it. And there's just, I mean, it's been a fire hose. There's never stopped being a total barrage of stories that I could cover and other reporters on the beat could cover. And, I did so many stories about just like absolutely batshit crazy laws that were happening. I mean, the funerals for fetuses law, I don't know if anyone remembers that. I think it was 2017 and it was passed in Texas. And I mean, it is what it sounds like. And so I'm like calling funeral homes in Texas and asking them, are you ready for this? And they have no idea what I'm talking about. And after a while, that gets a little bit, it's like a bummer, I mean, it's just how much of that reporting can you do? And so I really found myself being drawn to stories of activists who were coming up with creative ways or just brave, bold ways to enable abortion access in their community, regardless of where they were. So I did a lot of reporting on abortion funds or mutual aid groups or reproductive justice groups. And I think that was sort of, I still reported on like the bad stuff too. But I think that orientation, that focus was ultimately why I found myself very well positioned to report on kind of the modern abortion underground, because I was already paying attention to the people who are much more focused, not just on the politics, the courts, the law, which is super important, and we need people to lobby and advocate. Like, absolutely that matters. But I think that there was so much of the energy that was getting absorbed by what was happening on those kind of institutional fronts. And I was really trying to focus on the grassroots, on maybe the more radical wing of some of the activism. And that really continues to be, I think, optimistic to me and inspiring.
Is there support? I think this community in particular is often looking for ways to support the things that they believe in. The Fund for Investigative Journalism, could you talk a little bit about how they supported you?
Yes, thank you. The second part to your question I forgot to answer. So when I was thinking of the book, and I knew I wanted to do this international scope for some of the reasons I spoke about at the beginning. I knew that international activists were really pivotal in what was happening in the U.S. And so I applied for a grant from the Fund for Investigative Journalists, because one of the things I wanted to do was, I think I called the grant like tracing the black market supply chain for medication abortion. So I knew that these activists that I was following were traveling abroad and bringing tens of thousands of pills back in their suitcase, and all of the medication was coming from India. And they weren't always going to India to get the medication. Sometimes they were, but at that time I knew very little about generic pharmaceuticals and the Indian pharmaceutical industry. And so I really wanted to understand more about just like how and why that was such a thing. And so with the grant funding from that organization, I traveled to India, as well as a couple other locations, which, not to be mysterious, but I can't say where I was. But, well, okay, to be mysterious. But, and so in India, I was meeting with all of these pharmaceutical guys, and they were almost all men. There was one woman I heard about, but she wasn't available. And they're just like these pharmaceutical executives, and they're distributors, they're exporters. Sometimes there were middlemen that I met with, a manufacturer. And they're just like, yeah, Americans want to give us money for our medication, cool. Like, it wasn't ideological to them. And I think that certainly there are some laws and regulations governing the export of medications, but they also weren't too bothered about that. You know, you just pay bribes to the right people, or you mislabel something on an export document. And so actually being able to go to India and to meet with them and meet with the partners of the activists that I had been reporting on, and understanding where the medication was coming from and who was actually supplying it was incredibly revealing. Because one of the things I found was that there are all of these international family planning organizations that provide safe abortion access all over the world. Marie Stopes International, the International Planned Parenthood Foundation, IPASS are some of them. And so they're buying these bulk orders of abortion pills, right? They're ordering like 200,000 dollars worth of medication for a particular country in a particular month or something. And so there's this whole ecosystem in the Indian pharmaceutical industry of exporters and distributors and manufacturers and middlemen who partner, who are sort of like the people that are making sure those family planning organizations can distribute their medication. And it's really not that hard for some of that pipeline to get diverted. And so what that means is that even though it might sound really sketchy for someone to get like a plastic baggie of abortion pills in the mail, right? I mean, it kind of can, sometimes the packaging can look like if you're in a club and someone's like, here's some Molly, you know? I mean, it looks sketchy, which could be alarming if you're someone who's really scared and vulnerable. But the thing that I found is that the medication is often the same stuff that these international family planning organizations are distributing all over the world. It's coming from the same sources. It's legitimate. It is what it purports to be. There's enough active ingredient. And that's not to say that there's never bad actors, or that, you know, that's not to say that this is some sort of like perfect seamless pipeline. Of course not. It's operating in a gray area. But I think considering, considering that this is all kind of an ad hoc ecosystem that has emerged, it's pretty remarkable how safe, for the most part, the medication is. And then there's also organizations like Plan C, which I talk about in the book. Plan C, for those who don't know, they're an online resource about medication abortion and self-managed abortion. And they actually do chemical testing of abortion pills. So they'll do these mystery shopper exercises where they have online vendors and they'll buy pills from a vendor, and then they'll send it to a lab and they'll get it tested to see, is it what it says it is? Is it the appropriate amount of active ingredient? And then they publish those results on their website. And so if there is a particular vendor that is, their medication is of low quality, they'll get taken off of Plan C. And Plan C is how a lot of people figure out where they're going to go, what online source they're going to go to for abortion pills. So there's also this accountability ecosystem that has sprung up to make sure that it's as safe as possible. And actually, that's a really good example of how I found a connection or a resonance with a contemporary organization and one that was active in the 1960s. And so in the case of Plan C, a lot of what they do is vetting and sharing information. And chapter 1 of the book is about this organization called the Society for Humane Abortion, which is kind of considered like the first abortion rights organization in the US. They founded in 1965. And one of the things that they did was they had this document called the List. And the List was this huge vetted catalog of underground abortion providers, both in the US and abroad, that they really cultivated through word of mouth. People would tell them, I went to this provider, it was good, it wasn't good. They would send people as sort of like scouts to go visit, a particular clinic in Mexico. And so on the list, they would have information about these providers. They would have tips also for like how to cross the border and look like a tourist. Like bring your little sun hat and your Spanish English dictionary with you. And if the taxi driver says that you shouldn't go to that abortion provider, actually go anyway. Like she's great. It's just that they don't like her for whatever reason. All of this kind of secret information that made seeking an underground abortion, which was incredibly dangerous at the time, much safer. And so this like activist community crowdsourcing word of mouth kind of mechanism for making sure that abortion outside of the law was safe was something that, even though the technology today looks so different, the activists in the 60s were doing it and the activists now are doing it.
That ties into, there's another point where you talk about how activists frame their work in the 60s as underground work and now as community-based work and community change. Can you talk a little bit about that and how the activists themselves talk about themselves?
Yeah, so, I think back in the 60s, I wasn't around then, but from what I've heard from the interviews that I've done, is that, underground was sort of, back alley was a thing that people would talk about, but that was sort of part of the ethos. People were aware that that's what they were sort of engaging in. And so now, with a lot of the activists that I profile in the book, they don't necessarily identify with that framing. I think they think underground seems a little bit seedy, or it seems, it just isn't sort of what they're trying to project, I guess, to convey. And so they really refer to themselves as community support networks, because they see it at, one of their mantras is like abortion access is a community responsibility, by which they mean that our community is doing this with each other, for each other. And so, they'll joke about it. Like some of the activists that I talked about, they refer to themselves as, I think it was like a nefarious chemical abortion cartel. And that was like a joke, obviously. Like, I think they're kind of tongue in cheek about it. It's not that they're unaware, but they prefer the framing of community support network, because it makes it seem, it kind of makes it its own thing, and a separate thing, a different approach, a different model, a different pathway to access, as opposed to just some sort of like inverse of the overground system.
Is there anything you had really wanted to include in the book that you had to pull out just for time? It could be a long question, and then we're going to do questions after. So if you want to start thinking about what you'd like to ask, and we'll have a microphone right over here.
The scope of the book is pretty expansive. I'm honestly kind of shocked my editor let me get away with it, because I do cover 60 years of history, and I'm primarily focused on the U.S., but I went to Amsterdam, I went to India, I went to Poland, I went to Mexico. I looked at a lot of the international movements as well, so both in terms of the time span and the geographic span, it was pretty broad. But I think one of the things that's hard that I write about in the afterword is that you can never stop reporting, right? There's always so many new things happening. And so it was, I think, January of 2025, just 6 months ago, when I was writing the afterword, and the book had to get sent to the printer at some point. And it's just so stressful. It's stressful for a lot of reasons, but it's like new stuff is happening all the time. And there's sort of this impulse to want to include it. And at the same time, I had known from the beginning, back when I first was starting to work on the book, that it was going to come out after the election, and there was no way to know what would happen. And so I tried to be really intentional about writing the book in a way that no matter what happens in the election, it would still be just as relevant. And I think, even if Kamala had won, it's not as if the Supreme Court was immediately going to have another case and, get a constitutionally protected abortion rights back. This is the project of a lifetime. And so regardless of who won the election, the groups that I'm focused on in part 3 of the book, they weren't going to change regardless of who won the election. And it was interesting calling all of them back after the election, partly to talk about that, but also I needed to the book had to go to production in a couple weeks, and the people who were doing the illegal stuff were pretty chill. They were not that bothered. And then the people who were maybe doing something that was more kind of official, where they're subject to the laws and whatever happens, they were really the nervous ones. And so I think that was helpful in reminding myself that it's okay that, all of the abortion-related news that's happened over the past couple months that isn't able to be in the book, it doesn't actually need to be there. It's not that, it doesn't have any kind of bearing on the content in the book, but ultimately, these groups are doing what they're doing, and that's not going to change regardless of politics, regardless of the law, which is really the point kind of in the first place. And so, I don't know, that's sort of like a yes and no answer, I guess, to the question.
It makes perfect sense. Anyone that has any questions, if you come up to the microphone here, we could start taking them, and then I have about 30 more, so, get in while you can.
Hey, Rebecca. Thank you both for keeping on. I guess with your crystal ball, one of the things I think you didn't grapple with at all was the political environment. And I know that there are several groups now that are working hard in states where there's one or no abortion access clinics. And I was wondering whether you think, as we move into the future, the underground or the overground will take precedence in the access issue.
Yeah, I mean, I certainly, I know I've talked a lot about all of the underground or community support stuff, and that is the focus of the book. And in part, that's because I think there's been a lot more attention paid to the legal battle and the political battle. So I'm not trying to diminish the importance of those things, but ultimately, I think that the movement overall is stronger when there are the people who are fighting through those legal and political channels. They're fighting at their state level. The laws should be different. People deserve to have access to legal abortion wherever they live. There will always be a need for brick and mortar clinics, regardless of how ubiquitous abortion pills become. So those state battles are critically important. And actually, for the most part, what we've seen is amazing victories at the state level in places that you wouldn't expect. I mean, Missouri is now dealing with this complicated situation where they passed a state ballot measure protecting abortion access, and then now the Republicans are trying to do some shenanigans to make sure that the will of the people is actually not respected. So I think that you need to fight at the legal and the political level, and the fights have largely been pretty successful, like I said. And I think one of the lessons of the Dobbs decision was the harmful consequences that can happen when you totally put all of your faith and you hinge the entire access ecosystem on what judges and politicians do. I mean, that's risky. You can't trust them. We can't trust them, clearly, to do the right thing. And so one of the interesting things, I think, about the self-managed abortion ecosystem, the underground ecosystem, is that it functions on two levels. And this isn't my idea. There's an academic who I cite in the book. But it's this idea of transformative illegality is the term she uses. And it's that self-managed abortion functions on a direct action level. Here are abortion pills. And it functions on this cultural, political, subversive level where it's challenging the laws and it's undermining the notion that a government can control how its citizens, what the citizens do with their bodies. And there are a number of examples internationally, which I do cite in the book, of cases where self-managed abortion activism was essential to legal change. So I think the two main examples that come to mind are Argentina and Ireland. So in Ireland, in the Republic of Ireland, which, dramatically changed its abortion law in a way that a lot of people weren't expecting, Dr. Gompertz and Women on Web and all of their work on medication abortion and telemedicine abortion, the Senate cited that and interviewed people about that when they were debating the reform law. And then in Argentina has one of the largest kind of self-managed abortion networks in the world. They're incredibly organized. They're called the Zocaristas, and they published I'm going to say this word wrong. Epidemiological. I think I did it. I'm not going to try it again. They published that data on their website, and they were like, this is how many people we provided abortions to. It is tens of thousands. These are their outcomes. This is their age, and this is their situation. And they were really public about their work. And then Argentina changed its abortion law in a very, exciting way. But it's also a lesson because Argentina now has a president that has made a lot of noise about trying to change the law back again. And so the Zocaristas have never stopped their self-managed abortion work, even though the law changed, because they know that there's people who won't be able to access it through legal channels. And they know that if the laws changed again, they don't want all of that infrastructure to disappear. And so this is a long-winded answer to your question, but I ultimately think the most important thing, the best way to build a resilient ecosystem is to have all of the above and to have them working together as much as possible and to not have it feel like they're really separate, which Elizabeth and I were talking about this. There can be factions, within the movement, right? People who have fought to defend legal access aren't always thrilled by the idea of people doing underground work. And then I think people who do underground work can get really frustrated by all of the caution or the red tape that they kind of see with the legal system. So, I think you need both, and I think there is both, and I think the best way forward is for these different factions to really work together.
Hi, I'm starting to read the book. I highly recommend you get it. It's wonderful. And Rebecca's written a book called Birth, which is also very good. This wasn't in your purview, but I'm wondering if you cover the leak, the Supreme Court leak. I haven't gotten there, Alito's memo.
Yeah, I do a little bit, and I would say, the leak was May 2nd, 2022. And so part 3 of the book starts in 2020. It starts during COVID when activists are starting to think about distributing pills kind of outside of legal channels because they're adapting to the pandemic. And then SB8, the aid and abet law, happened in September of 2021. And so everyone knew that Dobbs was coming. Most of my sources were really not optimistic about, they weren't like, oh, the Supreme Court surely is going to uphold abortion rights. I mean, they were preparing already. And so I think the leak for people in my source network that I was talking to, I mean, sure, it was shocking because it was a Supreme Court leak, but I don't think there was anyone who was like, well, I didn't see this coming, So I think it just, if anything, gave them a little bit of extra juice before Dobbs came out to make sure that they were ready for what was coming.
One more question and then a wrap up.
I just wanted to give you an opportunity to talk a little bit about, if you wanted to, about medical abortion and doctor networks, doctors in general, in terms of providing care, but also in terms of providing training, because we have very little training now for doctors, abortion care, DNCs, I mean, even basic care. So we talked mostly about pills, but if that's something you wanted to talk about.
Yeah, absolutely. As I said, I think that it's so important not to reduce the future of abortion rights and access in the U.S. to pills, right? There's so many reasons why it's not a good fit for them. I mean, it could just be a personal preference. It could be a physical thing. There will always be a need for brick and mortar access. And yeah, as you said, education is a huge issue. Abortion training was already pretty hard to come by even before the Dobbs decision. A lot of medical students were having to travel. There's also been this whole wave of older providers who they got their start in the 70s around Roe, and then now they're retiring and there aren't always people to take over. I mean, both clinical providers, but also people who run the clinics, right? Who, maybe they're in a management or an ownership role, but it's not a great business for Elizabeth can speak to this better than I can probably. And so, I've met with students who they're traveling to go to abortion training programs, but they're becoming fewer and farther between. And it's, not everyone can uproot their life to go travel to California for the training program. And so, this might be kind of unsatisfying because I don't know that I have a great I don't have a solution to that, except that it's incredibly important because those skills can't be lost. They will always be necessary. And I think that also ties in, abortion care is maternal health care. People who are opposed to abortion, people who never think they would have one, people who are having wanted pregnancies need abortion, and they have abortions. And there have been all of these cases, legal cases and also stories in the media of women who are very much having wanted pregnancies, and then their own life is at risk, or there's a fetal anomaly that is fatal and tragic. And ultimately, the care that they need is abortion care. And people might not identify it as such, but that's what it is. And so if you're losing those skills, like the skills of a DNC or vacuum aspiration or whatever those skills are, that not only impacts people who are seeking an abortion, it also impacts anyone who can get pregnant, because you never know if that's the kind of care you're going to need. And so it's incredibly dangerous. And then this is in the broader context of a country where our maternal mortality rates are really, really high, and they're going up. And so, I don't know. It's not, that's kind of doom and gloom, but that's I think the situation. It's pretty scary.
And to that point, Rebecca's first book, Birth, is excellent. It's the lens of 3 women's experiences as they give birth in the maternal health ecosystem, which is failing, and really, I would say, pretty much failed in most places in the United States. Layered on to this book tells an incredibly complex story and also shows how we don't have to be here. There have been times when we're not, and there are places all over the world that are doing better than we are, and we can. So I want to thank Rebecca for coming. She'll be signing her book. Please buy many copies.
I would like to thank Rebecca Grant and Elizabeth Barnes for this incredibly important presentation. I've lived my career through this, and I am one of those old hippies that saw Roe v. Wade finally step forward and changed my career because of that. But so I'm very appreciative. Please, everybody, go to the signing. Go first to the book sales, buy Rebecca's book, and then go to the book signing and chat with her some more. In 5 minutes, we'll be